Well, if you're like millions of Americans who sit at a computer all day and type or overwork your hands at any capacity, you're going to learn a lot from one doctor, Dr. Pedro Loredo, who is from Renova Hand Centers, and with him is Yvonne Laurel, a patient. Good morning to both of you.
Good morning.
That video is so true. We do all of that.
Yes, ma'am.
And so, okay, let's first talk to you, doctor, about this, and that is, how do we know that something is wrong?
You start noticing the biggest things is pain, numbness, tingling. Patients complain they can't sleep at night. They're shaking their hands. They can't sleep. They're come in tears to the office because it hurts so bad, unfortunately.
So tingling, so you're saying there's a distinct numbness here?
Oh, yes. It involves usually these three fingers and half of this finger, and it can radiate all the hand and fingers and radiate all the way up the arm and shoulder and neck. Unfortunately, it's very devastating. Years
ago, when I was a temp at a law firm, I remember seeing some of the secretaries, word processors who were wearing braces because I believe they had carpal tunnel syndrome from typing all day. But we're typing all day as well. We type at work, we type at home. So we got to get it treated, it sounds like.
Yes, all these are additive factors, that new technologies that we have, the computers, iPads, texting, all that is additive. And also the other stuff, pregnancies, traumas, and illnesses, and all that stuff is additive, of course.
Okay, so Yvonne, you are a patient of Dr. Loredo.
Yes, ma'am.
Tell us first of all about your occupation and what you started to figure out. I think I have some problems here.
Yes, I've been in typing and doing office management for 13 years. And 5 years ago, I went to him and I told him it started to hurt. It took me a little time to get my surgery done, but I finally had it done on December 31st of last year. And it's been 5 months and it's been pain-free.
Pain-free,
yes.
Which is great news. You said it started to hurt. What kind of pain were you experiencing?
Numbness at night. I had to get up and move it around so I could feel it, shake it a little bit, take some medicine. Oh, yes.
Oh, medicine. Is it treatable aside from?
I was taking Tylenol relief just so I could go to bed, have a good night rest.
Oh,
Yes.
I see. Okay, and then you decided, look, I got to get this done.
Yes.
And so talk about the procedure. How can we get it treated?
Of course. Well, as she mentioned, we can do conservative treatment as well. But if sometimes it's really bad like she was, we have to do surgical intervention. Luckily for us at Renova Hand Centers, we have something called the Accucision, which involves a tiny little incision, which is about as big as a grain of rice. We put a cannula inside the actual carpal tunnel. Then we use a little blade to cut that ligament and get that pressure off that nerve, to allow the nerve to heal itself and make itself better. And we put you in a splint for about a week. We take the splint off, and after that, you can basically use your hand and basically do whatever you want to do right after that.
I'm looking at the video here, doctor, and where exactly is that pain on your hand? Is it right here?
Yeah, it involves the whole hand all the way up to the fingers, and then it can also radiate all the way up the arm and shoulder and neck.
Is that the kind of feeling that you had?
Yes. Yes.
That's got to be aggravating. When you feel the pain, but then it shoots into the elbow?
Actually, mine at the last minute, mine was all the way in my arm and everything.
Oh, yeah, you don't want that.
No,
you don't want that.
No.
I mean, with the amount of things, I mean, even looking at the video, with the amount of things that we do, I mean, you're carrying things, you're holding things, you're grabbing, you know, there's a lot to do with your hands.
Oh, yes. We try to return patients back to their daily activities, work activities, as soon as possible. Because you want to hold your baby. You want to hold your loved one's hand.
Yes, exactly. Okay, so if you think you might have carpal tunnel syndrome, there is relief. The Renova Hand Centers, they're located here in town, Oak Center Drive, Suite 440. Give them a call if you think there's something wrong. 855-49-HANDS. That's easy. 855-49-HANDS. Also check out their website, renovahandcenters.com. Thank you, Yvonne. Thank you, doctor.
Thank you so much for having me.
Stay with us. We'll be right back.